All right. Hello, everyone. I hope that you are hearing me. This is Gustavo Tolosa from Dallas, Texas. And I just want to make sure that you all can see us. Welcome, everyone. And we are having a special day today where we'll visit about several topics and about the 10-day program, living program Dr. McDougall has. And then I will let you all know what new webinar series we're starting next week. And I just want to welcome our beloved Dr. McDougall, who is having a lot of fun with his grandkids, and he is ready to go. So how are you doing, Dr. McDougall?
I couldn't be better to say I'm having fun with the grandkids. 5 of the 7, and probably more relaxed than you usually expect to see me. But I'm having a good time, and Mary just peeked her head in to make sure everything was fine. But yeah, we're having a good time. Our oldest is 13 that we have with us now, and the youngest is 2. And Mary and I have been having a good time with these 5. Our responsibility yesterday was taking care of the 2-year-old, and our responsibility tomorrow will be the 2-year-old also. But
yeah. Oh, and I see a little beard on your face.
Yeah, I don't have a shirt or tie on it.
Right. Well, you're relaxing. This is great because when you get back to Santa Rosa, it's back to activity, right?
Let's see. We're starting a 10-day program a week from tomorrow. And then I have to be, regular doctor kind of thinking. Probably have about 40 people, maybe 50 coming. And Dr. Lim and I will be taking care of these 50 people. So, yeah, I have to be back on my game as of next Friday. People will come with breast cancer and rheumatoid arthritis, overweight, and some healthy people who just want to stay healthy. Generally, let's see, I think the average age is about 50, maybe. We have people as young as 18 and as old as 90. But generally, they're people who are enjoying life, enjoying their families, but they realize that things are not going well. They're carrying around a bag full of drugs, and their future looks dim. I can only, as again, most of you know, as I'll be 70 in about 2.5 months. I can just imagine what many 70-year-olds feel like in terms of what the future is going to be, because they don't feel well. They're taking pills. They got doctor's appointments scheduled. They're looking for heart surgery and some way to fix their problem. Fortunately, Mary's going to be 71 actually, a month and a half. But did you see the piece that came out today on planning meals that Mary did?
I did it. I saw the piece. Very, very good. I think everybody else should have gotten it in their email box.
Well, if they didn't, they can go to the website, and somewhere or another, it's, I know where they can find it. They go under education, and then they go under videos. And then there's the video Mary did probably 10 days ago at the Advanced Study Weekend. There are a couple of impressions that people get, and I'm only guessing. The first impression I get when I see her is, how lucky I am, and to have a healthy friend and partner in life. And there's so much to learn. You'll want to watch that Planning Meals video 5, 10, 15, 20 times. Show it to your friends and relatives. I've had comments, you were at the Advanced Study Weekend, and people have commented to me, why should I pay to watch the whole weekend when I can get some of the videos free? Well, so don't why pay to watch the whole weekend? Mary and I have an obligation to share with you the things we know. And so some of the videos that we do, in fact, pretty much everything Mary and I do, we give away free. Like I talked about the sugar feed cancer, and about chocolate milk, which is disease in disguise. And I talked about Henry Heimlich, and then I did a whole rip on the diabetic industry, which, by the way, you all should be showing to all your physicians and dietitians and friends who have diabetes. It's a free video. And then Mary did 2 videos, which were very important to me, and now, of course, very important to her since they're done. One on planning meals. Again, you should be watching it. If you're trying to get into this program, you should plan a daily watch of that video, planning meals. And then there's also one on eating out that we put up. So we put up 4 hours of videos of ours for free. You can do anything you want with them. You can send them to all your friends and relatives and encourage you to do it. So why should you pay for the weekend? Well, that's 4 hours out of, I didn't count, but maybe 20 hours of the weekend. Some pretty amazing speakers during that weekend, weren't they, Gustavo?
They were. It was one of the best weekends, and
it was the best advanced study weekend we ever did.
Well, I've been to several, and I just can't, every one I go to is okay, that was the best. And then I go to the next one. Oh, that was the best. So it's you always do, put together a great weekend for us. I wanted to, Dr. McDougall, take just a minute here and just show people, because it seems as they should. And, they can go to right here to the videos, and gosh, you have hundreds and hundreds of videos, and they're all listed by topic. And this I love. Someone was asking about coffee a few minutes ago, and you put coffee there, and there you have everything that you have written or videos that you have done about coffee, but you can type anything you want in that box there. And just want people to know, because this is such a great tool, the search feature there. And since you were talking about the 10-day program, here's the 10-day program. And I love this video that you have here that people can watch. I also think it's great that people can see a sample schedule of what the weekend looks like. I mean, not the weekend, the whole 10 days. And anyway, I just want to encourage people to please go and spend a good amount of time on this website that Dr. McDougall has created for us with the help of his team, because it's an amazing source of information. Anyway, thank you for letting me do that, Dr. McDougall. I think that we should all go to that website more often.
Well, thank you. Thank you, Gustavo. I sent you an article earlier that people should also go to. I sent you an article like about an hour ago about doctors and the medical system.
Yes, there any way I have that. Do you want me to show it?
Well, there's some way I want people to see it. It's a discussion about the criminal behavior of the medical business in terms of patients and heart surgery. This is a bad day for the cardiologist. This particular article, when it came out, there it is. And when the evidence says no, but doctors say yes. So you all should read it. You should share it with friends and relatives. I have nothing to do with this article, except that I want you to be aware of it. And it talks to you about the things that I've been trying to talk to you about for 40 years. And it's no other way to describe it. It's criminal behavior on the part. I don't know, what are they going to do when this news gets out? Drive taxis? Again, don't think I'm overgeneralizing. There are some very important things in the medical business. There are some doctors who have not lost their moral compass. But this article has been sent to me by a half a dozen people over the last day and said, well, finally somebody else is talking about the things that you've been trying to help us with for the last 40 years. Anyway, we want them to know about that article. I'm sure you'll put that up on the webinar so people can share it. Share it with as many people as you can.
I read on the internet, and I think this is true, but I haven't spent a lot of time checking it. Did you read about the Prime Minister of Germany banning all meat products from any government functions?
No.
Okay. I think it's true because I've seen it several times. So if it is true, then hats off to Germany.
Well,
And
yeah, I mean, somebody is aware not only of the harm to people, but to the planet.
the planet, right?
And that's probably her, at least one of her motivations. So she's Prime Minister of Germany. Yeah, the news is out, and people are catching up. But there was something else I saw on here just relaxing with the grandkids. But they had a TV show on, and they had a commercial on.
Oh,
And the commercial, but it was something to the effect that the consumer must respect the temple, and that this is a disrespect to God. You know, some of the weight-losing businesses are getting down and dirty. They'll hit you below the belt, and they will tell you you are a sinner.
that's
And
right.
offending God.
Exactly.
Well, okay, if there is a God, and if this is what you believe, then my guess, he or she would say, the offense is you eating animals, my giraffes and my elephants and my cows and pigs. And the way to correct this sinning would be to eat what I gave you in terms of rice and corn and potatoes. Just guessing. I'm welcome to have any comments unless they're emotional.
I think that's a good guess that you're making, actually. Yeah. And you know, the lecture that you gave this past Sunday at the Healthy Taste of Sacramento was like one of the, I haven't seen you do a lecture like that before. It was, you know, you didn't have your slides or a specific topic. Well, it was a specific topic, actually. But I really enjoyed it. Can you just summarize in a few words of what you said to all those, like about 300 or 400 people there?
Well, I could, if I could remember. But first, before I try and remember, I want them to know, and this has nothing to do with me, but Gustavo, you and AJ have a link to that weekend that people can go and purchase. Garth Davis and Doug Lyle and the Iron Chef, and Dr. Craig McDougall, and you can purchase this whole weekend for a reasonable price, and you'll let them have the link to that. But no, I was there on Sunday, and Chef AJ, many of you know, she says she didn't say this to me, but this is what I heard, and it doesn't matter, that you can't show any slides, and you must say something new. I had an awful lot of fun. There were probably 300 people there, and the audience allowed me to relax and just kind of talk about what I wanted to talk about. And for an hour and 15 minutes, I think that our rapport between myself and the audience was unique and very much appreciated from my point of view. I hope everybody that watched live, because you can't get the same thing on videos live, almost, and you're going to tell them how to get it.
Yeah.
It was an amazing experience for all of us. But I think what I said, something to the effect that the world is worth saving, and right now we can save it. You know, right now, there is a planet that's livable by 7 billion people. There are things that are going to change, and you can't hesitate. But I asked the audience and all of you, we can't hesitate in terms of fixing things. It's not like we'll put it off until next year. And one of the major things that we must fix is the food. I've talked about that a lot. We've got to stop making the primary source of calories animals. And instead, I'm talking about fish too. And instead, we have to turn back to the traditional human diet, which is starch-based, potatoes, rice, corn, and so on. And the audience was, at least from my seeing eyes and listening ears, they were very much engaged with the same kind of thinking, including the minister, John. Well, this was done in the church. It was just happened to be done in the church. Everybody seemed to be thinking the same things. So it was a great experience. I thank you, Gustavo, and I thank AJ and Linda Middlesworth. And, you know, if I started naming names, somebody would say, well, you forgot me. I was really, yeah, I thank everybody for the opportunity.
Well, you encouraged us with a lot of passion to really start taking more the initiative to get the message out there. And we, when Dr. McDougall and when I say to all of you to please help us, we really mean it. Help us by talking to people, forwarding this information in your social media. And you did a great job because you did engage the audience. They all spoke, and it was like a town hall meeting kind of thing.
Well, I look at other, you know, just to say the least, as I get older, my eyes get wider open, and I look at other people who have passion. And again, I don't want to name any names because I'd be comparing myself with great people. Who I am inspired by and aspire to be like. Yeah, but this is important. If you can lead, you must lead. And I try to do that. And I'm sure I shocked Andrew Taylor, that Spud guy, when he asked me to do a little bit of live discussion for his website. And I just said to Andrew, as many of you heard me say, offended or not, I don't care. We must stop the liars, polluters, and cheaters. That's all there is. And that's not only because of my life, which has already been pretty much lived, and Mary's, but our children and grandchildren. I think that was the essence of the discussion. And I don't think there's a person out there that disagrees, whether they're Republican or Trumpish or Democratic or whatever you are, is that the world's worth saving. We have some important ways to do it. But anyway, that's history. Gustavo, you given the link. I can never repeat what I said, nor my son Craig McDougall or Garth Davis or Chef AJ or the parts you put into it. So let's try not to relive that.
It was great to see all these young professionals like your son and Garth Davis and Rosanna Oliveira, these young doctors that are going to, take the torch and continue. Your son did an amazing job talking about the transition to a plant-based diet. And I've heard him talk 3 or 4 times now, and I must say that every time he gets better. So it's wonderful. Very good. Well, you also said that once we know the truth, if we don't do anything about it, that's just not acceptable.
No, it's not acceptable. Those who know must. We have a duty to do.
We do.
Let's get back to the 10-day program. Again, you're going to get them the link so they can watch you.
Yes.
And then we get to some questions. We do start a 10-day program a week from tomorrow. And we're very excited about all the people that are going to be there and all of you who still want to come, which will be March 6th, I think we start. March 6th, whatever Friday is, March 6th, 2017. Close enough, and you can talk to Carol. But that's when I get to be the best person I can be, Gustavo. I get to touch people and help them with their troubles. And so I look very much forward to it. And again, we will have people with problems as little as being healthy and want to have a future that's different than their parents or grandparents. They will want to get off their blood pressure pills or the diabetic pills. And by the way, all this information is free, particularly when it comes to the diabetic industry. It's free as a video on my website, the scams of the diabetic industry. And by the way, I've had nobody come back to me, nobody from SmithKline and Glaxo, the drug company, no doctors, no dietitians, no pharmacists come back to me and say, well, you misrepresented the science in your January 2017 newsletter, or you misrepresented what's going on in your video, which is free on the website. So, what will happen next Friday is people will come in with various forms of diabetes, various degrees from type 1, full type 2. And Dr. Lim and I will minimize, which if it's type 2 means take you off all your diabetic medications. insulin and pills. If you're type 1, we'll reduce your dose of insulin and get you to understand what's going on a little bit. And if you're in between, we'll make judgments. So that'll happen a week from Friday. We'll also be taking most people off their blood pressure medications. If not off completely by the end of 10 days, we'll be putting you on the safest blood pressure medications. But I guess most importantly, we'll be giving you control of your health so you don't have to wonder why you're sick or how you do well. And we're going to do that. And that's why the 10-day program is most fun for me, is that people give me that privilege.
I remember what you just said. I guess there is one of your grandkids there, right?
Yeah. Do you want to be part of the webinar? And go
plain.
She told somebody yesterday when she was asked about her eating. She says, I'm allergic to eating animals. And actually, the person who asked that question had to call her mom and ask what she meant. She was very clear. She says, I do not eat animals. I'm allergic to eating animals. Anyway, from a 4.5-year-old's mouth.
Well, a lot of kids and adults don't make the connection that that package that they're buying at the grocery store was actually an animal. I mean, believe it or not, the industry has done a great job taking away all the image and the suffering, and we just see that little box. And yeah, I'm sure that some people need an explanation. Well, so people are getting anxious about questions here. How about if we do some questions? Okay, so actually, this question is about the 10-day program. Do you have to be sick, or can anyone attend the program? And part 2, what tests are included? EKG, blood panels, thyroid, the basic CBC, A1C, etc. Or, well, anyway, you can explain.
As far as the question of do you have to be sick, everybody eating the Western diet is sick. You can call that sickness various things as simple as constipation and hemorrhoids, or indigestion, or as complex as 80 to 90 to 100% closure of many of your coronary arteries, or cancer in your breast or colon. So the program is generally designed for human beings who are not doing well. And it's not that you can't get the program for free. The program is free on the website. However, we have, would I be fair to say, Gustavo, we have the most effective, intelligent, caring staff of any place that I've ever met.
It is, yeah.
So the program involves you getting involved with our friends and staff and helping you get over all kinds of hurdles, like stopping your medications. Who's going to stop your medicine? What other doctor is going to stop your medicine when it's necessary? What other doctors are going to tell you to not go see the heart surgeon? Which, by the way, refer back to that article I discussed a few minutes ago. It's really hard to find the medical help that you deserve and are looking for. It's not that it's not out there. And so we provide that in a 10-day program. I think that's the most important thing, is that our team is willing to do the right thing for you. As far as testing, we take some blood tests the first morning. If you need other types of outside testing, like say you need an EKG or an angiogram, we have many doctors in the community who can do that. However, we don't. That's not part of our business. People usually have that done when they're home. They bring the records. We don't do any fancy testing because it's not necessary. We do repeat blood tests at the end of the program. We weigh you a couple of times. You adjust within, I tell people they come on Friday. and they won't get it until Tuesday. And so over the next few days, they see Dr. Lim and myself, and they have their medications reduced and stopped in most cases, not all, but in most cases they have them reduced or stopped. They have to get adjusted to that whole idea that they're not on a bag full of drugs. Those have been their best friends for a long time, and many of them are very, very, very dependent upon them. But after their medications on Friday, Saturday, or Sunday are reduced or stopped, they go, "Whoa, I'm still alive." Of course, yeah. And they kind of find their way around the resort. They start to like the food. One interesting thing is by Tuesday or Wednesday, no matter what arrangement we make of the menu, we can change it every time. And by Tuesday or Wednesday, people will look at Mary, Heather, I, Tiffany, and the rest of the staff, and they'll say, "Why didn't you serve that the first day when we came? This was really good." It just takes you a little time to adjust. And so they love the food by Tuesday. They love being off their drugs. They love feeling good. Oh, did you, by the way, feeling good, Gustavo, do you have any way to refer to that video that was put out about, and this is public knowledge, so I would never violate any HIPAA issues or privacy issues. But this was put out publicly, and I'll make sure you get it if you haven't seen it yet, from one of our very recent patients who was herself a physician who had been to 2 hospitals in Los Angeles, major hospitals, major universities, who was, she's still diabetic, overweight, and such severe coronary artery disease that both hospitals threatened her. I don't mean just ask her, recommended, but threatened her to have heart surgery. And her and her daughter came to the program recently. I'm not going to identify the program, even though it's public knowledge. Came to the program on lots of insulin, lots of diabetic pills, lots of everything, with no hope. And her daughter happened to be a producer and of television, and they put together this amazing video which involved her, the patient, mom, sick with diabetes, terrible coronary artery disease, and daughter, and a couple of nutritional experts, and a couple other people. So there's 7 people on stage, white background, and I'll send you the link to it, where they talked about the experience. They were very frightened about coming to the program and wanted reassurance from me before they came. I exchanged a few emails, and I said, "Look, we're going to do the best we can to help you." So here she and her daughter and this team containing 5 other people on a white background, extremely professionally photographed. This is online. We probably don't even have to link it. You can find them in McDougall and heart disease and diabetes or something. Anyway, so they did this presentation, and here's mom down, and this a lot of weight, on very little insulin, on no diabetic pills. I would just guess, and this is a typical patient. This is not something. This is not like when you watch Weight Watchers with Jenny Craig, and they say, "This is the best case example. Do not expect this. You should expect this." So anyway, she's down in weight. She's feeling phenomenal. She's, I would guess, down from 15 medications to much reduced dose of insulin and one other medication. She got her life back. And that's available on video, and I'll send it to you, Gustavo, so you can link it, and it's all public now.
Yeah, yes.
So that's what the 10-day program is about. We've published on 1,615 people. I've been doing this for 40 years in a living situation. It's not that sometimes things don't work out. Not that sometimes my guesses are not correct. Sometimes they're not correct, but not very often. And believe it or not, Gustavo, some people don't follow my advice.
That's true. Yeah, they're worried about those numbers, aren't they? Sometimes, like the glucose, and then you tell them to not take insulin or something, and they still take it, and they end up on the floor or something. I don't know.
Well, those things happen too. And then when they leave the program, everybody's very enthused at the end of 10 days. They think they found the answer, which, we believe. Right. And then they get back into their regular living situation. They find things a little more challenging than being locked up with us.
Right.
And, it may not work out as well, but they've always, forever, they have their eyes open. They know.
Now they know.
And many people come back. In fact, we encourage you to come back if you'd like 2 weekends or the 10-day again. But I would have to say everybody's better off from the experience. And I'm talking about the patients and the staff. I think everybody's better off.
Yes, and even though, one of the big benefits of going in person is to get the medical care from you and Dr. Lim, and ask you questions in the private consultations, and also to try the food and meet other people. But your whole program, your 10-day program, is actually on your website.
Yeah, it's free. It's actually described as a 12-day program.
All the lectures are there.
Everything's free.
Yeah, and I have met people who actually follow the 10-day program from the website. They never attended the live event, and they had very big success. So it is possible to do it that way.
They've had not just a very big success, they've had the exact same results.
Right.
If you attend the 10-day program. But
yes.
I do have to comment, tax time is coming up. I could prepare my own taxes. I could go to the library, read the laws, spend days figuring out how to prepare my taxes. I could do it myself, but I don't. I have a CPA who's well-trained. I hand them the problems. He or she gives me the answers, and I sit back. And that's kind of what we do at the 10-day program.
That's right.
All the information is free. It's well-organized. There are no gimmicks. You're welcome to do it yourself. Of course, always we tell you that you must have proper health care supervision when you're dealing with medications or serious health problems. But then again, for most of us, like me and my taxes and other important issues, I don't have time to acquire the 40 years of experience my accountant has. And you likely don't have time to acquire the 30 years of experience Dr. Lyle has, and probably 20 years of experience of Dr. Lim, and the half a century of experience I have, and the half a century of experience Mary has. So we're here to help you. It's
right.
It's basically that simple.
Dr. McDougall, someone asked if any part of the program could be covered by insurance.
The simple answer is no. The actual, some people have taken the trouble to get some of their part of their program covered, but we don't deal with insurance companies. We don't deal with Medicare. There are programs, by the way, that do deal with Medicare, such as Ornish's program or the Pritikin program. They've worked hard to get covered under Medicare. I've not done that for a whole variety of reasons, including I don't need to have the government, Medicare, et cetera, be involved with your personal care. So I've had the luxury, the fortune of not being involved with insurance companies, be they Blue Cross, Aetna, or the U.S. government or the Canadian government. And my plan is to never change that intrusion.
Right. I may be wrong.
Yeah, I want to mention, Gustavo, the program we run is costly compared to what? We run programs for big companies, which, by the way, I encourage you to share what we do with any company that you know, any business you know. And like the last program we ran for CenturyLink, I think there were 120 people in it. And just to give you, this is whether it's private or public, I'll just give you a statement that I made to the 120 people from this very important telecommunications company, is that what it costs the telecommunications company, CenturyLink, to send 120 people to our program with all the care from Dr. Lyle, Dr. Lim, and there's 7 other physicians who work for me. And the hotel, resort stay, and the food. What the cost was for this entire program was less than one heart surgery gone bad. or even gone, a couple of them gone well. So here I am, a company, okay, I'm a business. I'm trying to, balance the books, and I'm self-insured, or I have to pay some other second party to provide health care for my company, and I'm the guy that writes the check, or the gal that writes the check. I'm looking, I'm saying, let's see, shall I spend half, $750,000 making my employees well? And by the way, it costs me $2 million to replace one employee. Or should I spend $500,000 or $1 million sending my key employee or not so key employee? Because believe me, if you are a clerk at Whole Foods or sweep the floors or own Whole Foods or whatever, bypass surgery costs the same. So am I going to spend this, say, $1 million on one of my employees who it's not going to work? You read the article we talked about earlier. Am I a wise business person? Need I continue? I would. One of my goals, my present goals, is to get more companies: Ford, General Motors, IBM, Apple, mom and pop store around the corner, to get you to think about your employees. Think about, well, let's see. If I'm self-insured or second-party insured, they're going to raise my insurance rates if something goes bad with my employees. Am I going to spend my money on the medical way to approach the problem, which is, as I say, cut, burn, and poison or whatever? Or am I going to spend my money on fixing the problem, which is the food, and then I get to keep this key employee, which will cost me $2 million to replace, and at the same time I can educate another 119 employees, which will cost.
Yeah, it's not hard to figure out what the best answer is for that. Yeah, Dr. McDougall, I wanted. Oh, you said something. I'm sorry, I just lost the train of thought. But someone here is asking, and I'm just going to redirect her, because you and I have done about 3 webinars where you have discussed in detail the topic of ketosis. So we're not going to go back to that topic. You've covered it in depth. So Rebecca, go back to the website and the webinars. They've been recently, like last month, I think, and they're there. Anyways, Dr. McDougall, would you let me ask you this question that someone sent about lupus. It says, could you offer some advice for a beginner in tailoring your program for someone with lupus? What are the most important things to focus on?
Well, the first thing is to get the education. And as you were just saying, how do I find out if there's any real, scientifically supported way to deal with the problem? One which I could discuss with my father-in-law, my physician. Is there any other approach to the problem of inflammatory, serious inflammatory diseases like rheumatoid arthritis or lupus? And the way you find that out, just hit back to a general subject that you were mentioning, Gustavo, is you go to the website, you look at, there's a box called search, and you put in lupus and or inflammatory arthritis or whatever. And you find out the various articles that I've written. I could have just as easily told you to go to the May 2014 newsletter, which discusses inflammatory arthritis and gives you a couple notes on lupus. We may have a Star McDougall or two discussing lupus. You'll have to take a look. But lupus is a disease of the Western diet. It is caused by eating the Western diet. I've cared for a lot of patients with lupus. It doesn't respond as quickly as something termed rheumatoid arthritis or psoriatic arthritis. It takes a little bit longer, in my experience in general, for somebody with lupus to resolve the problems. Like a patient with rheumatoid arthritis or psoriatic arthritis, in 4 to 7 days, they're already going, well, I've discovered the miracle. Most of them. And it does happen sometimes that quickly with lupus, but in general, lupus, which is a very, very severe autoimmune disease, involving the kidneys and the skin, all the tissues. In my experience, it takes a little bit longer, and we're talking about, say, 4 months. And issues such as gluten-free, which I hate to even mention, are discussed in that May 2014 newsletter, or when you get the search engine. But yeah, if you have lupus, even if you are starting to have kidney disease and heading for a dialysis machine, yes, a dietary change will make a huge difference again. Or excuse me, not again, a huge difference in your future. I kind of got another thought that came to mind. And when we were talking on Sunday about, when you gave me the opportunity to give a lecture, I did have to start the lecture with a statement that we will make America well again. And it's already come up on the website. Maybe other people have thought about it. But that's our goal, ladies and gentlemen, right now in 2017. And you all know what I'm talking about. Is we are going to make America well again. Yes, we can.
Yes, we can. And
way too much.
And you said, Dr. McDougall said, today, which was February 19th, 2017, we are starting to make America well again. And
that's kind of what I was thinking. We are starting, we've started a long time ago. I think there are folks, again, I had great communication, I felt, with the audience. And what I said is that February 19th, 2017 is the Independence Day, where we will not look back. The low carbers, the cheaters, liars, and polluters. The low carbers are done. Those are the people recommending that you eat everything that walks, flies, or swims. They are finished. There's no turning back. There is no further confusion. We will not tolerate them to even give their opinion again, because they've already dominated us for the last 20 years. Some of your minds. We're done with them. We will make America well again.
And
we can.
And I think that February of 2017 is the right month to do it. I don't know if you know this.
I kind of lost
you. Is that showing on the screen?
Yeah.
This month has 4 of everything. Has 4 Sundays, 4 Mondays, 4 Tuesdays, 4 Wednesdays, 4 of everything. It happens one time in 823 years. So this change is not going to happen until 823 years from now.
Amazing, Gustavo. I will share that fact with Mary.
I was doing math, and that would be, if we went back 823, we would be in the year 1193. And I thought it was an interesting trivia.
That'll dominate my thinking the rest of the day.
Okay, well, this is the month to make the change and to start it. It's not going to happen until 800 years from now.
Good.
Okay, so someone was asking about a topic that I hear myself, or I used to more of, which is liver cleanse. Do you think that a person should worry about doing liver cleanses? And if so, what kind? Some people say that you have to take half a cup of oil and drink it, or some nonsense like that. What do you say?
This, again, I've been in this business half a century, and what I hear is something called a gallbladder cleanse. And that's been taught as consuming vinegar and olive oil to clean out the gallstones, a gallbladder cleanse, which may be similar to a liver cleanse, but it's vinegar and olive oil. And if you look on my website, by the way, I wrote an article maybe 15, 20 years ago that looked at this exact subject. This is not a new topic. And what they did is they, people would take this gallbladder cleanse or liver cleanse, and then later on that day or the next day, they'd look in the toilet. and they would see these opalescent round globules that looked like gallstones. They go, see, the gallstones passed in the toilet. Well, what researchers did wouldn't be my preference of a job to do. But what they did is they took these opalescent circular objects out of the toilet and analyzed them. What they were globs of olive oil. So, but still, the idea of a gallbladder or liver cleanse persists, and people will look in the toilet and they go, "Oh, they're my gallstones." No, those are just globs of olive oil. The way you do cleanse your body, the body is naturally healing all the time, and to make the liver most efficient, you must feed it carbohydrate, sugar. And you say, Dr. McDougall said sugar. You have to understand what Dr. McDougall means. Sugar means starch like potatoes, rice, corn, and then you most efficiently power the liver. So the body's always trying to cleanse itself. And once you stop poisoning it with animal foods and oils, then the healing dominates. So yeah, you need to do a cleanse of your liver, your brain, your muscles, your kidneys, and so on. The way you do it is you stop putting poisons in it, and then it naturally cleanses itself. You don't have to buy a whole bunch of expensive supplements. You don't have to go to any special offices where they give beams of something to whatever to make your body extra special in its cleansing and healing ability. This is all, AJ has the right verbiage, but I won't use it. It's all garbage.
AJ is here today. She's on the webinar. Well, what you said, Dr. McDougall, is something that comes at least once in my mind every day. Because my grandfather, my dad's dad, was a medical doctor. Today I was looking through some stuff, and look at this. That's my grandfather's.
Oh, wow.
He had this. Yeah. So he had this on the door. He worked in a hospital, but he also had his he saw patients at his home. He had a room to see patients. And I remember I was a teenager. He always said what you say, and it is the body is constantly trying to heal itself. You just have to let it. And he used to say that, and it's special to me because you say it, and my grandfather used to say it. And I remember those times when people went to the doctor's house, and I remember him walking 2 or 3 blocks to the patient's house because he cared so much about the patient to check up and see how they were doing.
I would treasure that sign. Nothing's changed, Gustavo, in 100 or 1,000 years. And again, those physicians and dietitians listening, don't take any of this as a critique. Take it as a critique. Don't take it as a criticism. I understand that you understand the basic principles of healing, and you also know that we're involved in a business, the medical business, which should be held accountable. And all of you, if you refer back to what we started talking about maybe 45, 50 minutes ago about the article published that you showed, there's behavior going on in terms of big medicine, big farm, and so on is not justifiable. And they ought to be held accountable. They are being held accountable, as we just discussed. February 19, 2017 is a date that you, Gustavo, and I, and AJ, and many of the doctors in that live audience and listening right now, we're just not going to look back in terms of being nice, politically correct, tolerating what I kindly refer to as the garbage, the nonsense, the lies, liars, polluters, and cheaters. It's over.
Yes, and another thing, Dr. McDougall, that I got from your lecture, but I've heard you say this before. As I read comments here, and I see, unfortunately, people that they just need to listen to some of your lectures and read what you say. The research can show you anything you want. some, I mean, if it's made in a certain way, because some people are saying, well, olive oil is healthy. Well, depends on what study you're looking at and what kind of information. And it's frustrating.
Well, I understand what you're saying. The statement is you can prove anything with research, but that's unless you're informed. Like, for example, the head of the Cochrane Collaboration, Peter Gotze, who was a friend of mine. He's an extremely intelligent man, and when he reads the research on mammography, he is not fooled. And so he wrote a book, Mammograms, Truth, Lies, and Controversies. He wrote it about 6-7 years ago. So he knows how to read the research. And H. Gilbert Welch, who's from Dartmouth College, when he reads the research on mammography or PSA testing, or the U.S. Preventive Service Task Force, or the Canadian Preventive Services Task Force, or so they can't fool people who know how to read the research and understand how they manipulate the methods.
Right.
To the less informed, or to those of you who want to hear good news about your bad habits, you can find research to prove anything. I happen to have the good fortune of being able to understand what is being said for the most part in the science. And when I don't, I go to the letters to the editor and get my better informed colleagues to help me understand what's going on. But the truth is the truth. You can't change the truth.
You can't.
So when you say people get confused by research, only if they want to be.
And you did a wonderful webinar only on oil that people can see, where you present this research. And so I want to encourage anybody here on this webinar that still think, or they're new to the webinar and they don't go back and look at it. Well, this has been a wonderful time together, as usual, Dr. McDougall. We will close it since we are at an hour of transmission, and we look forward to seeing you next week. And I do want to announce to people where you are starting a very practical and very wonderful series, and this series is going to be based on this book. So starting next week, Dr. McDougall is going to be discussing one chapter per webinar, sometimes maybe two, I don't know, and taking questions. And who doesn't? I mean, we all know people who have digestive problems. Maybe some of you have that. I certainly was one of them. So this book is available on your website, right? And it's also in other places like Amazon.
You can buy it at Whole Foods. Unfortunately, the reason I've hesitated to do this series is the other series we've done, like we did one on McDougall's medicine. I gave you the book for free.
Right.
It's a worldwide bestseller, and the publisher has every right to to their share of the book. But you can get it on Amazon. You can borrow it from the library. But we're going to discuss that. And when you say people who have bowel problems, well, I'm a general doctor. I used to be a family practitioner. I can tell you, when you get to talk to people, and you really sit there and doctor the patient, you talk to people about their bowels, which I know is not your favorite subject, but everybody eating the wrong food has bowel problems, because you can't take the intestinal tract for human beings, which is designed to live on fermented starch, rice, corn, and potatoes. You can't make it work right if you feed it foods designed for a cat or a dog. It just doesn't work. Just like you can't take a cat, we're talking about a designed carnivore, a cat, or a lion, a house pet cat. You can't take a cat and somehow make its intestinal tract, which is perfectly designed for the cat, function on potatoes or corn or rice. We can start with that simplicity, and we'll move on with the details with those lectures next week.
I know that you're not in this webinar series because you want to sell the book. I mean, you want to do it because it's a wonderful topic, and like you said, you would probably give it for free, like you did the other book if you had it. This book.
My guess is a $12 investment or something like that.
Yeah.
Don't quote me, but again, my guess is if you decide to purchase the book, you'll say that was one of the best few cents that I ever spent. Who knows?
Worth it. Yeah. Yes. Next week we're gonna do.
Don't bother telling.
Exactly. The chapter for next week is chapter 4, which is called "My Stomach's on Fire," and I can't put it out. So.
Let me give you an option for those of you who are in places where you can't get the book. Is
okay.
Writings for that book are free, and they are on my website. They are in my 2002 newsletters, which are free on the website. And so for the whole 12 months of 2002, I wrote the chapters, the basic chapters of that book. However, to present it so people could read it, I had the great opportunity to get involved with Howard Bartner, who did the illustrations for the book. He was the head of medical illustrations for the National Institutes of Health. So he did all the illustrations, and I also brought a comedy writer in because it's the bowels are a dark, shameful topic. And many people have told me that this is a book that they sat down, they read from cover to cover. And I do understand, but it took a team of people to get you to read about the bowels from the lips to the other end with enjoyment.
Yeah. Well, thank you. Thank you so much for your generosity to give us your time during your vacation. And it's very appreciated, very much appreciated.
I enjoyed it very much. I hope I look relaxed. And I'm having fun. So,
while the rest of us have to go back to work.
I not have to. I get to go to work next Friday.
That's right. You get to go to work. All right. Well, thank you again. And thank you for joining in. And we will see you all next week for another Week with Dr. McDougall. Okay. Bye-bye. Thank you, Dr. McDougall.
Thank you, Gustavo.